Yeah, the topic before us is food security and COVID-19 effects on the vulnerable. Well, last year, nobody planned that the whole world will go on on a lockdown, that the whole world will shut down pending the pandemic. So at the beginning of 2020, about 135 million persons faced food insecurity. You can see the diagram before us. This was actually a CSIS Global Food Security Program initiative and a research that was carried out. And of course, you can see the duration. There was an early in the year and also later part of the year as well. By the end of this 2020, this number could increase. So that was the projection, actually. Yeah. And okay. Yeah, the background, research experts in the global agriculture sector have asserted that fast-spreading COVID-19 pandemic across the continent of Africa and even across the world posed a negative impact on food security. Since the pandemic has presented an opportunity for the total consumption of homegrown food, it also reaffirmed more or less the need to develop the agriculture sector of most developing nations, that is the vulnerable nations. However, due to the lockdown, there has been a hike in prices of food and other agro-commodities and essential commodities. Of course, demand for food has always increased within the period due to the persons are now more at home and there is a greater need to consume. So we all know that there were issues that we kept facing. And you can see a display of organic foods that we are advised to keep eating and then keep being healthy as well. You can see that food security is not just a term, is also a concept. So it has already been conceptualized. And it is said that it exists when all people at all times have physical, social, and economic access to sufficient, safe, and nutritious food to meet their dietary needs and food preferences for an active and healthy life. And interestingly, the concept of food security can interchangeably and, of course, conceptually mean the dynamics of the agriculture sector. So most times, you can interchangeably use food security to replace agriculture sector and also the other way around. So demand for food has also increased because people spend more and more time at home with greater need to consume. And farmers might have laid off staff at that time because food production is supposed to be ongoing because food, among other basic priority needs, is very important. And of course, arguments have always happened, especially recently, that shelter is even more needed than food and clothing. So, of course, that's thought from food for thought for another day. Yeah. So. So these are, for us to understand the concept of food security, we need to look at the pillars or the dimensions of food security. So there are four major dimensions of food security. The first one is availability, that is food availability. If food is available, then that takes us to the second pillar, which is accessibility or access. Of course, the vulnerable countries or the vulnerable communities do not have enough food, but some of them that have food, like here in Africa, we have lots of food. So that means food is available. But can food be accessed by everyone, by the poor masses? So this, will now take us to the third pillar. Now, that will also broaden our minds and give us more insight to begin to mirror down into the developed world and now see if they have completed the 4 pillars of food security. Well, I know that in the US, some of my friends in the US have also told me that the United States is not particularly food secure as it were, because it's an example of a developed nation. And but I had always argued with them that we are looking at the vast majority of the people who have actually experienced the 4 or even the 3. Now, in the vulnerable communities that we are talking about, where have they stopped? Have they reached utilization? Now, coming to stability, is food stable or is food sustainable? Yeah, so, well, that will take us to the next diagram, which is, I had to, articulate it in this dimension, 3-dimensional approaches in ensuring food security. So the first circle there is on security as well, which is ensuring that all people across the world have access to sufficient food to meet their needs. So this has already laid the foundation and a platform that every man, every human being on the face of the earth has the right to eat food, to enjoy food, from the point of availability, accessibility, utilization, and then stability. Sorry. Yeah. And then the second has to do with safety, which is at the right-hand side, ensuring that people have healthy, nutritious food that is free from contamination or degradation. And then that takes us to food sovereignty, that is empowering people to make their own choices and about the food. Of course, you can attest to the fact that where it comes from and how it is produced has also become very important. Okay. Yeah, food systems in the era of the COVID-19 pandemic crisis. We had to look at food systems, and it's similar to the previous diagram. You can see that it is actually affected by food safety within the pandemic crisis. It's also affected by the bioactive ingredients supporting human health. And also is also affected by food security in itself within population lockdown. Then it also is also surrounded by sustainability of the food systems in this new era. So, and I'm happy that I'm in the midst of the College of Medical Sciences. In my university here, I am the Faculty of Agriculture representative to the College of Medicine. And over time, we have been brainstorming and looking at how we can incorporate, the culture of practicing agriculture as we are supposed to practice agriculture. That is taking us to food security so that we can be able to tackle this issue of food insecurity. Who are vulnerable persons? Now you can see that the vulnerable persons are minors, pregnant women, prisoners, persons with mental disabilities, persons who are illiterate or have limited formal education. Now also persons with limited access to health services, women in some settings as well. Now, I had to articulate this definition properly because, of course, you know that there are many schools of thought with respect to describing or defining who the vulnerable persons are. Vulnerable population include patients who are racial or ethnic minorities, children, elderly, socioeconomically disadvantaged, uninsured, or those with certain medical conditions. Members of vulnerable populations often have health conditions that are exacerbated by unnecessarily inadequate health care. From the perspective of the National Health Insurance Scheme, a vulnerable adult is actually a patient who is or may be for any reason unable to take care of him or herself or unable to protect him or herself against significant harm or exploitation. Now that takes us to the 4 main types of vulnerability: social, cognitive, environmental, emotional, or military as well. In relation to hazards and disasters, vulnerability is a concept that links the relationship that persons have with their environment to social forces and institutions, and the cultural values that sustain as well as contest them. Now, an affected population, if also we are still talking about vulnerability or vulnerable persons or people that fall into the category of the vulnerable. An affected population is a group of people who are directly or directly impacted by a conflict or a disaster. So you can see the affected population may be refugees, internally displaced persons, stateless persons, vulnerable persons. And then you can see the pictorial representation of these people. And I'm always passionate about these vulnerable persons in our midst. We meet them every day. Some of them are beggars asking for help. Some of them are even practicing agriculture in a micro scale, and or in a small or medium scale, depending on their scope of operation. And I will always encourage us to also see ways, not just to leave it for the government, in our personal lives, to see how we can affect them, because they are all over. The other day, I went to the, I had to buy garden egg. There's what we call garden egg here. It's very rich in antioxidants. And so I had to buy it because it's seasonal. It doesn't really come all the time. And when I bought this fruit vegetable, I was touched by the woman that sold the vegetable to me, because she, I became ignorant. I became guilty after I had, bought from her, because I was pricing her lower than I was supposed to price her. I was telling myself that I should have also helped her as well, because she, no doubt, fall into that category. Yeah. So pointers, we need to look at pointers. How can we get a guide? How can we be guided to identify them? Now, sometimes we say, okay, how can you know them? Some people pretend and they appear as if they are vulnerable while they are rich people. Well, they may be middle class, maybe, okay, in India that has a class system, you can understand that vulnerability can be diverse. So from research and also fact and finding, we have seen that disability can be a pointer. Of course, poverty, languages spoken at home, population density, vehicle ownership, country of origin. Of course, you can immediately draw a conclusion that most sub-Saharan African countries, that are about 54 or 55 countries of sub-Saharan Africa, are vulnerable. Now, I know we have about 60 countries in Africa, and 5 countries are in Northern Africa. That is for Libya, Egypt, Morocco, Tunisia, and Algeria. They are not counted in the sub-Saharan African countries. So, of course, you should know that the other countries, now there are also frontline countries in other, like within sub-Saharan African region, that have also exceeded with respect to experiencing transformation or economic growth and development ahead of others. Now, also age can also be a pointer. Of course, when you look at very young persons, you can categorize them. Those that are helpless, you can categorize them as being helpless, or they cannot be able to afford what they need at that time. Yeah. So that will take us to the next slide. Yeah, you can see pictures of vulnerable persons. And you can see also pictures of vulnerable farmers who are actually practicing crude agriculture. And they are not, even in this era of fourth industrial revolution, when lots of nations are embracing the blessings of the fourth industrial revolution to use to help with the concerns of farmers who Sometimes they are smallholder farmers. I can tell you that these categories of farmers are very powerful in developing countries, not just in Africa alone, also in most of the selected Asian communities as well. Now you can see palliative during the pandemic. Some people were given palliatives, some because of corruption, corrupt practices of not channeling it down so that people who are vulnerable could receive these assistance. They could receive food, which many persons were even dying of hunger. A colleague of mine was called me at that time during the pandemic, during the lockdown last year, and she was crying, shedding tears, and she was saying, "Have you seen the videos of people who are dying, who are practically dying in our midst? How can we reach out to them?" Yeah, so, and okay, now many measures aimed at tackling the health crisis have interconnected short-term. Of course, you can see that you can categorize how the impact of the health crisis, how it has been measured, and how it has also affected food, nutrition, and security as well. Yeah, distribution of impacts of COVID-19. You can see the world distribution. And the red color is group one, that's low-income economies. And the low-income economies are also the vulnerable communities. That is where you get the very poor persons. And the group two is the yellow portion. And you can see how it is represented. Part of it is in South America. Most of them are within Africa and also in the Asian countries. And the group three is upper middle income economies, which is green. Now, the white portion, you should tell yourself where the white portion belongs. That is where you get the developed nations. Now, global worst affected food insecure regions, focusing on Africa, because of course you can see that the region where vulnerability is highly seen or experienced is in this sub-Saharan African region. Of course, you can see that Yemen, Democratic Republic of Congo, Afghanistan, Venezuela also is not in Africa. Ethiopia, South Sudan, Syria is not also in Africa. Sudan, Northern Nigeria, and Haiti. Haiti is not in Africa. These are countries that have been recognized out from research to be highly vulnerable to food insecurity, as it were. Now, the prevalence of food insecurity by country within Africa, the moderate or severe. And of course, we had to select three countries as as a case study to look at how they have been able to experience food insecurity. Burkina Faso, and the blue portion is moderate or severe, while the pink color is severe. You can see the severity more in Nigeria with respect to adults. And then you can now see also Malawi, which is in the SADC region, SADC region, and also sometimes they are, they are referred to as countries that close to landlocked countries, as it were. And then you can also see Ethiopia. Ethiopia has done well with respect to getting transformed through the agriculture sector, but Ethiopia is also having that issue, and Burkina Faso, and then Uganda as well. Yeah. Now there's a situation report here on food and agro supply chains and value chains during that period. Now, levels of sophistication in supply chains and value chains between Africa and the industrialized countries vary widely. It varies widely, actually. For Africa, the production system requiring less advanced systems will definitely suffer some setbacks and encounter some difficulty adjusting to the unexpected. And complicating the situation further is the lockdown order and the attendance restriction to movement. We did not spare the agribusiness community in many parts of Africa. Agriculture stands out as one in which a lot of financial support will be needed to help resuscitate farming and non-farming activities. And then there's a diagram before us here, and that diagram is captioned agriculture, food systems, and nutrition meeting the challenges. Now you can see how this complex diagram having food outputs, with sectoral linkages to non-food output, and then how it also linked to food prices, which is also linked to food imports and demand side effects. Can I say something with respect to all, with just this, the 4 points in the diagram, which is at the apex of the diagram? You can attest to the fact that there's, that the prices of commodities are getting higher by day. Where I am presently here, the food prices, is something that is a very big issue at the moment. We're having a lot of disruption in the food supply chain with respect to issues surrounding, this region and that region. A region where huge supplies come from. Remember that in Africa, we have communities that are experiencing rainfall more than the other areas. And of course, those areas that experience rainfall is where you get rain-fed agriculture, because the more people that, there's a larger number of farmers who practice rain-fed agriculture than those who use technology in practicing agriculture. And so, but there is increasing attention and increasing awareness and also interest by private investors and even the government to encourage irrigation or irrigated farming, and also bringing in some technology, but it's actually, it cuts across the African nations, whether in the ECOWAS region, which is Economic Community of West African States, and then the SADC region, which is Southern African Development Community countries. That is where you find South Africa, and sometimes we refer to South Africa as an African country with a difference. That is an African country that's far ahead of other African countries. I have also been to Morocco. I lived in South Africa, but I've been to Morocco, and I appreciated Morocco a lot with respect to how they have been experiencing transformation, taking us back to the African Continental Free Trade Area Agreement, which is also encouraging this, which is encouraging African countries to, in trade among themselves, that is intra-African trade. It's also linked to all of this, I tell you, because why? Why is it linked? Because there's, a perception, and sometimes we refer to it as a bias, that when we trade with the developed countries, that we are not most times favored. And so when we keep importing food, what the implication of importing food into, from outside of Africa, what does it imply? It implies that we will spend more money, importing food instead of developing the capacity of the smallholder farmers, of the food producers, of the people who are in the food supply chain at the head. Now, without taking much of our time, you can see that diagram is quite loaded with food income consumption, food income from markets, non-food income, farm, they are all, like a chain. And you can as well link it up to women employment, women health and energy expenditure. Can I say something about the women and the youth in Africa? Women and the youths have been identified as, the gender that will drive transformation. So every intervention for agriculture, every intervention that will help agriculture must recognize women and also the youth. So we must have to paint agriculture. We must have to do what I call brain re-engineering, changing the perception of our farmers, changing the perception of our youth, sorry. Our youths, they have a perception problem that farming is for the poor, that farming is for the people who are vulnerable. But that is wrong. So, and that is what we have been trying to develop frameworks on how to change the face of agriculture, and then have to bring in, have to change it in such a way that we will start practicing it like even in the developed world. Without taking much of our time, we have to move forward, and because of the time. Yeah. Now, there are compounded effects of COVID-19 and desert locust outbreak on food security. Of course, we heard about the Kenyan attack, of food locusts, which was very devastating. Lots of farmlands were invaded by locusts. And we had to interview farmers in that Eastern African region. And of course, we learned that lots of countries around there were affected, like even Ethiopia to some sort, and even Southern Sudan. And Uganda, those countries that surrounds Kenya, it was very bad. And it's also, contributed to food insecurity in the region, of course. It led to distorted food demand. You can see from the diagram, obstruction of food delivery, destruction of food production. And it doubled with respect to COVID. So it was like, a double attack at the same time. It was, hitting on food security. So most developing countries are hit by food insecurity, by lots of issues, even climate change issues, which has already been noted. Now you can see food crisis and health crisis and security crisis. These are major issues that attack the vulnerable communities. And it keeps hammering on food security, leading to a lot of people having food, becoming food insecure. How can people, quality food, not just to eat food, but what is the, quality of food that people eat? Because the function, like the quality of food that one eats is a function of longevity, is a function of healthy living, is a function of healthy living. So when we eat properly, we also live longer. So what does it tell us? That the vulnerable people, most of the poor, I mean the poor, people who are living below that, amount of $1 or $2 per day, are not able to even buy fruits and vegetables that are rich in antioxidants and that can fight disease in the body. Now, the region faces simultaneously several crises, placing public budgets under strain and all of that. Yeah, you can also see from the diagram COVID-19 deaths, 100,000 persons by race and ethnicity through September 10. Now, what foods to avoid during the COVID-19 pandemic? Now, these are foods to avoid and foods, to also, eat at that time. Yeah. Impact of COVID-19 on markets in northern Syria. Syria is not in Africa, but is a country which is high, has a lot of vulnerability because of the wars and a lot of issues that they are facing now. They have really, really, really been the the country has really suffered a lot. So they have produced a lot of vulnerable people. And we are clamoring for the United Nations and the Food and Agriculture Organization to help to emancipate uh, the vulnerable. Now you can even see what's the reports from the northeast Syria and from the northwest Syria. Reported number of days before hygiene vendors would run out of stock. If supply lines were cut, 15 respondents, at that region, and then 179 respondents also for the northwest Syria region. Now, average food price, like I articulated also in that diagram that has the food price in it. And you can see that food price in African countries, you can look at it and see how it's getting higher by day. It's really, really an issue, I tell you. And when it keeps going, that is when social vices will keep heightening up. People will become more prone to endangering themselves. So, people are not even job secure. Many people are so unemployed. Okay, if you are at high risk of severe COVID-19, protect yourself. Yeah, we will keep saying that. Now let's look at the government policies and measures with respect to the pandemic and as well as food security. Socioeconomic impact. Of course, you can see the arrow that, goes straight to household food and nutrition. Socioeconomic issues surrounding the income status, surrounding the household size, surrounding a lot of issues that touches on, like the personal information, age, and all that. You can relate them to the policies which the government of a nation will, enforce with respect. That is why the academia has a very strong role to play in this, because of course researches that are being carried out, we have to keep recommending, we are policymakers. Yes. Yeah. This is a very interesting diagram that presents Sahel and West African region with respect to food and nutrition situation. And the first diagram by your left, can you see how food insecurity is represented in phases? Yes, phase one is minimal, and that is the ash-colored region for minimal, and then the yellow-colored region is stressed. So they are so stressed. So, and you can see that Niger, Chad, and most parts of Burkina Faso and Mali, and even parts of Senegal and Sierra Leone are actually in that category. And even part of Nigeria as well, towards the northern region. There's crisis also for the brown part, and you can even see it represented in Nigeria as well. Can I talk about Nigeria a bit? Nigeria is a very interesting country with respect to having a robust economy, but some regions are very poor. Some regions are, struggling, heightening, and of course, Nigeria is regarded as the giant of Africa. As in the West African region, so you can even see in the phase four, the red color is phase four. Talks about emergency, and then phase five is famine, and then the other ones as well. Yeah, so these are advocates of trying to help to handle vulnerability in our nation. So the United Nations, UNICEF, UNDP, and ACVN. Yeah. So the impact on food supply pricing health and nutritional status. You can see scarcity has driven up prices. I've said this before. Yeah, and you can see global pandemic and food supplies, and the impact of coronavirus on supply chains is likely to result in millions facing food shortages during that period. Yeah, I've already taken note of that. So we need to understand the role of food supply chains, and we need to understand this properly. Now, I had to conduct a research. This research I carried out, I have to be fast with this now. For the developed countries, I had to look at Europe because I spent a lot of time in Europe within the first 3 months of this year, and I can tell you that there is no vulnerability in developed countries. So, well, that also juxtaposes why we have to focus on developing countries. And I know that part of South America is also experiencing food insecurity to some sort. Now, there's disruption of food supply chain by COVID-19. I have already said that as well. Now, resultant measures by selected vulnerable nations to COVID-19 pandemic. You can see Angola. Angola, what did they do? They banned fuel exports. Egypt, they banned exports of all pulses on 30th March this year. Ethiopia, Ghana, land border all only allowed for essential goods. And then for Ghana, only vessels carrying fuel, food, stuffs, medicines are permitted at the time. And then lastly, Zambia. Zambia, you can see truck drivers with cross-border consignments undergo extensive screening and border entries. So these are measures that we are also put in place. Now you can see also a food supply chain. 17 million, the number of acutely malnourished children, which also are, the vulnerable under 5 years across the 55 countries and territories analyzed in 2019. And then effect of COVID pandemic on food security, focusing on the vulnerable nations. The effect of COVID-19 pandemic on the agriculture sector of development is negative. Yes, it's very negative. Hence, it's threatening food security. What threats are we talking about? Total lockdown remains the biggest threat, of course. In crops and livestock farms, where technology or mechanization is employed, social distancing could still be duly observed while farming work continues, thereby enhancing food security. Affordability is still another negative issue, entrenching COVID-19 effects on food security. Now, the vulnerable are the worst hit in this irrespective. Yeah, so staff, the next slide talks about COVID-19 effect on food security, which is negative. And also negativity can be felt in two broad ways. The first one is that it constitutes a hindrance to smallholder farmers, and then also unable to afford food for them, among other basic priority needs. So it poses a great threat to vulnerable nations suffering from poverty and poor healthcare infrastructure. It also poses a great threat to social safety nets, those that lack social safety nets. It may also prove especially deadly for vulnerable nations, that's persons from chronic to acute hunger and malnourishment. It may also cause breaks in food supply chains, as I said earlier. It may also cause global economy to slow or fall into recession, exacerbating extreme poverty. The diagram. Now, steps to reducing the risk of vulnerable populations during COVID-19. Improving social determinants to promote healthy living. Utilizing a global budgeting national health care system is very important. Providing of access to virtual health care. Match hospitalization needs to surrounding communities. And then to support community appropriate healthcare access, among other suggestions to reduce this. Now, there are some issues, there are some positive effects of COVID-19 even on the vulnerable communities, like far-reaching positive development of the food chain supply chain, and we have to keep encouraging them with virtual internet and all that, rubbing together knowledge sharing between and among stakeholders of government, so that the developed nations can also see where to encourage our vulnerable communities in one way or the other, because the vulnerable communities are also very investable. Like in Africa, Africa has become very important in the scheme of things. Right now, Africa has so much vast resources with respect to agriculture. So why should Africa be highly food insecure in this, in this pandemic? When we have most food items we export, but we don't export in such a way that our economy, the economy of Africa, is also, getting, blessed by the foreign exchange earnings, by creating more jobs, and then even ensuring food security. And of course, that is why the Africa Continental Free Trade Area Agreements has also been developed. Thank you.
Professor Agbugba, a heartfelt thank you this evening. I have no doubt that we have been well taught and enlightened. Thank you for a lecture well presented, comprehensive, very real, and very current. COVID-19 negative impact on food security. The lockdown not only resulting in increased food prices, but being the biggest threat. Food security, not a mere term, but conceptualized and being very relevant in the current pandemic. And two areas I found very interesting. Foods to avoid during COVID-19. I have to learn. Virtual health care. And an interesting comment, and which I think, and I can be corrected, that it's debatable, shelter needed even more than food and clothing. Professor, I must say that I hope I'm not imposing, but for the University of Guyana, in the event that you are returning virtually or otherwise, and they should have this discussion, I really would like to invite myself. I would like to hear this discussion. We are going to permit audience. We are going to try to take all of your questions possible, whether they be put in the chat on this platform or you unmute your mics, or whether they are posted on Facebook. They will be transferred to me. But before we do so, we will have the privilege of having our Deputy Vice Chancellor for Academic Engagement, Dr. Emmanuel Cummings. He's no stranger to us, and he will take the platform to give us some remarks. Dr. Cummings.
A pleasant good evening, and thank you very much, Ms. David, the chair for this evening, our distinguished dean, Dr. Boston, Assistant Dean, is the Vice Chancellor. Oh yes, Vice Chancellor, our esteemed Vice Chancellor, Professor Mohammed, and I have noticed also Dr. Murray, Director of IDC, and other administrators from the College of Medical Sciences, Medical Director, and most appropriately, Dr. Agbugba. I hope I can pronounce your name. I must thank you for a very enterprising and interesting lecture with regards to food security. You did touch on a number of issues about with respect to the vulnerable population, but also I just wanted to add a few things which I think might be useful, even as we debate and talk about, the issue of food security. It's an old one. The effect of climate change, and so on top of climate change, we now have COVID, which even make us even more vulnerable. Being ill When we look at the statistics, we see mostly males. Male are more vulnerable, and they are the farmers. They're also the head of the household. So we look at the socioeconomic impact on the family themselves, and what great effect can COVID have. But also, as Professor, as you look at the countries mostly affected, but also those are the same countries that are the poor that are affected with poverty. And we know with poverty there's anemia, which is very much associated. We talk a lot about obesity and all the other chronic illnesses that make you more vulnerable. But poverty of itself is most of those countries that you have listed. When you look at the rates of anemia, and on top of that, you now have COVID, which certainly affects you, primarily your respiratory system. So it further compromises, from a health perspective, persons who already have a shortage of certain nutrients and are vulnerable to certain nutritional deficiencies. And on top of that, so there's a lot of considerations there. And again, the most vulnerable person there are the pregnant women and our young and children. Those are the most vulnerable persons with anemia. And also on top of that, you know, have COVID, and that is something which we need to think about. But you know, also there are opportunities. In Guyana, you go to the supermarket and for sure a lot of ginger and a lot of turmeric and a lot of fruits and vegetables, lemon and limes and all these things. Persons are turning to nutritional supplement to boost their immune system as we fight off the disease. And so there's an opportunity for farmers. And so that's become an opportunity now where farmers 2-3 years ago, I don't think those farmers would have sold so much of ginger and turmeric and fruits and vegetables and all of that. But they're always in sale. And so that it creates an opportunity there, but even with that opportunity comes another risk, because food security deals not only with the supply but also the composition of the food. Now, farmers now, with the haste to increase their production at a shorter time, turn to fertilizers. They turn to chemicals because there's an increased demand for healthy foods in order to boost your immune system. And therefore, to do that, they tend to use a lot of chemicals to boost their production, and a lot of these chemicals are sometimes carcinogenic. And so it's so wide in terms of when we look at the effects of COVID on food security, apart from creating a shortage, apart from creating loss of employment and looking at all socioeconomic factors, which affects household, but it also, and I would wish to emphasize, it also creates another issue where chemicals now to increase production. You spoke already about trans fats and its relation to obesity and chronic diseases, but cancer. So, and cancer itself is persons with cancer are already vulnerable because they're in chemotherapy, and also they're also vulnerable to the pandemic, to the SARS-CoV-2 virus. But on top of that, now they're developing cancer. So we're going to see much more cancers in much younger people. So indeed, I think I really would like to congratulate the dean and faculty from the College of Medical Sciences for having this lecture, which I think it's timely, very educational, done by this distinguished professor who took us through a number of issues which are quite relevant, very educational, and certainly it has helped us to be better prepared to deal as a country, as a university, who has that responsibility of ensuring that we lead the way, we find solutions as a country for our nation, but it also gives us that opportunity to educate ourselves and also to make better decisions. And so, with those few words, I don't want to give another lecture, but just to comment and to really, really express my sincere thanks to Dr. Agbugba for embracing us at the level of the university. And we do appreciate your thoughts, your knowledge, which you have shared with us. And certainly it will help to make us very much more prepared in confronting this pandemic. And I wish to thank you very, very, very much, notwithstanding my compliments for the entire administration of the College of Medical Sciences. And thank you very much.
Thank you, Dr. Cummings. Thank you very much. You have said few comments, but your comments have been very pertinent and searching. Diverse negative effects, shortages, or economic factors, but considerations for the increase of chemicals which can be considered carcinogenic. But we also note, as you have said, an opportunity, nevertheless, for farmers. Thank you very much. I would now like to announce the question and answer segment, where we will take your questions, and I said as far as possible, we will allow the professor to answer your questions. We would like him to answer all as far as possible. We'll be looking both at the chat and also those from Facebook. I'll be accommodating those. They will be sent to me. And so I'm trying to take them in sequence. I note from Gary Joseph that he is thanking the professor for the wonderful presentation and also presenting some questions. Can you please explain how language spoken at home and population density act as pointers for food insecurity during the COVID-19 pandemic? Language spoken at home and population density, how can they act as pointers for food insecurity during this COVID-19 pandemic?
Yes, thank you for that question. In fact, I expected someone to actually ask that question because it's actually quite vague when you hear it for the first time. But when you look at it again and brainstorm, you can understand it better, that it's more like a perception, like a perception pointer. There's what we call perception pointer. That is when people, the type of language that they speak, like if you meet Africans, or maybe if you meet some Asians, you can say, okay, these are Africans without even seeing their color. Some Africans are not black people. They are not, dark skin. Some Africans are actually fair, like in the Northern Africa, even in Southern Africa as well. And some Africans are actually whites. We have white Africans as well. So when you look at them, they may speak like, a language of those where the vulnerable persons are. Then you can now say, oh, okay. They are the vulnerable people. I don't know if you understand. So that could be a pointer. So that is from that angle where it can, and most times it has actually worked, when you understand the languages of people. Of course, if you hear Americans speak, you will know, these guys are the Americans, and of course they are more food secure than the others. Yeah, when you also get to maybe you met an Englishman in Kenya, and the Englishman speaks, of course, you will know, even if he is not dressed, like an Englishman, from the way he speaks, you will know. Yeah, so that's actually how it's appointed. Then the other one has to do, you mentioned population density. Yeah, because population density, has to do with, the number of people or persons, number of persons in a country or a region. If it is too much, and looking at the statistics or looking at the mathematics, this number of persons in this area that are jobless, like where people are migrating from that area, and then they have this population. It could be a challenge. It could be a pointer that these people are food insecure. Yeah, so, and without the numbers of people handling, having good jobs, and also um, engaging in some production, food production, and also um, being part of, transforming an economy by what they are doing at that time. So when the working population or when the working age is not engaged in transformation, it could, with respect to population pressure, then you can say, oh, these guys are actually food secure. And I like what the Deputy Vice Chancellor said. When he mentioned about food security touching on not just, people feel that it's just when they eat and drink water, then they are food secure. No, are you eating correctly? Eating correctly. That is the thing. Remember that the definition of the Center of World Food Security, 2009, is when people eat properly. Nutrition comes in, eating correctly. Remember the 4 pillars I mentioned: food accessibility, food availability. If food is available, can the food be assessed? If food is assessed, if that food has been assessed, can it be utilized? How is it being utilized? If it is utilized well and in the proper ration, then it will definitely yield the dividend. Why is it that the life expectancy of people in the US, of people in the UK, in developed countries are more than the life expectancy of the vulnerable community? So that is also, of course, draws the conclusion that food security. And then have we reached the point of food being stable, food being sustainable over time? You come in, you eat the right food, not just to eat junk. Yeah. So let me stop there.
Thank you very much, Professor. I am also learning not just how much you eat, but what are you eating? The 4 pillars and the manner in which they are all interrelated. Thank you very much. I note some other questions in the chat by Mr. Gary Joseph. However, I have a question that has been posted on Facebook, has come in from Facebook, and I will take that before I return to the chat. So, Professor, the question is, you have mentioned that there should be access to virtual health care. Can you explain how this virtual health care is possible?
Of course, virtual health care is more prominent in the developed world, and virtual health care it actually refers to, it's more like using technology, even including phone calls as well. Phone call is also part of it. Like when I was in the UK, I was a bit sick, so I was made to speak with a doctor, and the doctor was actually trying to diagnose me from the phone and all that. And I got my result, even though at some point I went physically there because it was something that I had to go physically. Also, video, even mobile app, text-based messaging and all that, they are all part of mental health care. So we should be able to promote it at such times. And if it's adopted now, it will work amazingly well. Thank you.
Thank you again, Professor. Virtual healthcare, more prominent in the developed world, but certainly not impossible in the developing world. Thank you very much. I move to the chat again. Talking about Haiti and Venezuela, were the estimates presented due to true effect of COVID-19 pandemic or to some other unmeasured variables such as political crisis, etc.? Were those information from recent national surveys?
Of course, it was a recent research that we actually carried out, and it also showed, reported that. Remember, we have a chain. Okay, I didn't mention it. We have a chain of researchers that carry out researches from time to time, and it was actually last year. It was actually carried out last year, and it was discovered that these countries were actually prone to high food insecurity. They were high vulnerable places. So if you need more information on that, I can also guide you to get more information on that. Thank you.
Thank you very much, Professor, and also thank you for the offer of more information. Very much appreciated. In continuing, in slide 20, this is in reference to one of your slides, Professor. In slide 20, what is the difference between moderate or severe and severe within the country?
Well, thank you for that question as well. The level of severity with respect to prevalence of food insecurity is actually the ones that lead to death and the ones that are quite very bad in the sense that people are not working. Of course, if you are not working, how can you be able to put food on your table? So those are the severe cases. Now the moderate cases are the people who are not working, but they can depend on, they have people that they can fall back on. Like I remember that when, it's a very sad story to, about some communities in these vulnerable places where people graduate from school, they don't have job, and they resort to navigate the situation by traveling to other countries, by migrating in the name of going for education, and they just get in there. Well, they were able to raise money, so we're able to get scholarship opportunities and then move out. So you can now see that the severe cases where small, are most times smaller than the moderate cases, because the severe cases is actually at the extreme.
Thank you very much, Professor. Searching question. If you are not working, how can you put food on the table? A very searching question. And also from your answer, a very gentle reminder of what scholarship opportunities can actually do for us in terms of enhancing food security and taking us out of that vulnerable context. Thank you very much. Question again from the chat. What do you mean by non-food income in the conceptual framework presented? And that's because you presented in the same level another box that is farm or non-farm income.
Well, thank you for that question as well. I'm trying to get to the slide. Okay. Yeah, well, non-food income is actually income that is generated and is not committed to food. Because, you know, there are some people who generate income, and then their income is actually, you know, well, they could be business persons, and they are recommitting that particular income that comes in back. Like, you know, the initial outlay is also the initial capital for a business or something of that nature, or, you know, that money can be recommitted. But the non-food income is the income. So when the vulnerable communities are actually using up even the non-food income for food, then there is a challenge. Yeah, and you know, it is worthy to note that food expenditure involves spending expenses on food items, that is on consumables, you know. So while non-food expenditure is spending or expending on non-edible items like, you know, electricity bills, rents on houses, maybe recharge card, well, you know, for your communication and, you know, social media, which is also very important as well. Yeah. Now, can you rehearse the other question? Have I elucidated on that question properly?
I would think so, Professor, because the second section was a kind of an explanation why the question was asked. The question was asked because you presented it in the manner that you presented it. That's why the question was asked. In the same level, okay, yes, as farm and non-farm. To proceed, Mr. Noel Holder is thanking you for a great presentation, and rightly so. And he's also asking a question on how much planting is done at the household level to improve food security.
Well, that's a very good question, because most of the questions are quite intelligent, I must confess. I never knew that Guyana is, you know, a country where you get very high intellectuals. In fact, I started to appreciate Guyana when I met, you know, Cecil, Dr. Cecil. But initially, when I was a child in 1990, I remember I met a Guyanan lady who is an American, you know, Guyanan American. Well, to go, you know, to talk about the question, or, you know, to respond to the question, can I say that the Sorry, can you rehearse that question again? Just remind me of that.
Yes, Professor, not
Okay.
a problem.
Okay.
How much planting is done at the household level?
Yeah.
Yes.
Yeah. Thank you so much. Yeah. So I was actually trying to say, to respond before I started to digress. Now, smallholder farmers, remember I said in my presentation that smallholder farmers are very powerful set of drivers of Africa's economic sector or Africa's agriculture sector. Now, with respect to that household farming or home garden, it's very important because for instance, if everyone has a farm at the backyard of his or her house, you are able to, you wouldn't depend solely on, going out to buy everything, even the vegetables. I traveled to the UK in 2019. I remember I visited a couple who had already finished launching out their children. So their net was already empty. And this man who was over 70 years went and he had already harvested. In fact, they prepared a meal for me because they heard I was coming. So, and they prepared a meal. And when I arrived, they told me, "Do you know what you're eating is gotten from the backyard?" I was like, "Oh." He said, "Yes, all that we eat comes from the backyard. But it's only us that eats it. We don't sell it." And that inspired me a lot. Even recently, while we were thinking on how to develop a curriculum, how we can develop, a write-up, a document to encourage African youths to return, to start practicing agriculture. Start practicing agriculture, start thinking like the Dutch people. Start thinking like most of the Europeans who have not left agriculture at all. So I can tell you that the smallholder farmers, even remember that they could also be micro, like the question goes, if they are micro, depending on who they are servicing, or whether it is their personal home, or whether it is on a commercial basis, depending, it's in line with the motive or goal of the of the practitioner. So that is it. But do not forget that smallholder farmers are drivers of transformation. 60% of Africa's smallholder of African farmers are smallholder farmers. So every intervention must trickle down to them because they are actually helping to tackle the issue of food insecurity. They are even helping to provide jobs. Yes, because many people do not, many people are lacking jobs and people are now gravitating towards agriculture. Right now, as we speak, people that read medicine and surgery, engineering, those people are coming back to practice agriculture. And some people are even saying, okay, no, we will go on a food, we have to increase the scale of the scope. Thank you.
Thank you very much, Professor. Thank you also for the extensive explanation. I note here in the chat that we do have another question. However, before that question, I would like to indicate to you that the Vice Chancellor has mentioned in the chat that she's thanking you for an enlightening experience and for sharing your time with the University of Guyana. She has indicated that she had to leave for another meeting. We know her busy schedule, but she wanted you to know of her appreciation and also the College of Medicine for organizing this initiative. She has given us her blessings for safety. So, Professor, the Vice Chancellor has conveyed to you her thanks for your presence at this initiative.
Thank you.
We continue. You're welcome. We continue, and in the chat, Ms. Lewis is saying, thank you, Professor, for an informative presentation. Question: are there enough methods used to inform or aware the nation of food security? Are there enough methods used to inform or aware the nation of food security?
Okay, thank you for that question. Are there enough methods to create awareness or to inform people about food security? I think there are not enough methods, because if there's enough methods, the perception would have changed. The perception issue would have changed. And in some communities, people are still so ignorant and adamant that they will not embrace agriculture. Let me tell you a little bit of myself. I grew up in a university environment where my parents worked. And when I was growing up, I developed passion in the line of agriculture. And, those times, having to decide to pursue or chart a course in the agriculture profession was looked as something weird. It wasn't, like everyone, who's going into engineering, law, pharmacy, medicine, surgery, and all that. So, but when I mentioned agricultural economics, they were like, my siblings were like, why are you going into this profession? What, don't you know that you will be looking for a job? But I persisted because I already, being the last child of the family, my mother pushed, used to ask me to go and weed the farm, to do this at the backyard. And somehow I started getting friendly with vegetables, started getting friendly with fruits. Look at the death rates, look at the mortality rates. People are dying so fast. You don't even understand what is going on. Many people are so afraid of life because they are not eating well. People think that they are eating well, but they are not eating well. They are going for fried, I wasn't able to, expatiate on the food we are supposed to be eating. Yes, I am in the midst of medical people. I am also from a medical family. Most of my nieces and nephews there, most of them are studying medicine and surgery, like 4 or 5 of them. And when can we be able to sensitize our people on food security so that any approach, what of the mass media? I'm not saying that enough is not being done. Enough is being done, but how are we able to communicate this? For me, I am a university professor. I know what I tell them, and I am not even trying to boast or say that I am, doing much better than my other colleagues. But I think most of my students will attest to the fact that what I tell them is not just the theory part of it. I tell them stories, and most of them come back. A lot of them are coming back. I'm telling, sir, I have established a farm. Sir, I have this, I have that. Some are into cucumber production. Some are, into horticulture. Some are doing well. They have land, and they are doing well. They are able to even put. They are able to raise money for their master's program. Some have finished them, one thing is that the ground is so fertile for agriculture now, especially here in Africa, especially for developing countries, even there in Guyana and in other South American countries. It's in principle, let me round up by saying, it's in principle that developing countries can attain transformation only through the agriculture sector. I'm not saying that there are no countries that have attained transformation aside of agriculture sector, but the agriculture sector is a primary sector of which every other sector depends on the agriculture sector. So we need to enforce, we need to be very proactive, we need to enforce strategies, we need to recommend strategies on communication, mass media, print media, electronic media, and so that we can let people know what agriculture is all about. Thank you.
Thank you very much, Professor. And I'm looking at your terminology where you became friendly with fruits and vegetables. I have to adopt. Thank you very much. To the audience, we have had much discussion, but as it is said, all good things must come to an end. And so this is one of those good things that must come to an end. But before we close, the Dean of Medical Sciences, Dean Boston, and I must commend the College of Medical Sciences for this initiative. It has been most enlightening. And so the Dean of the College of Medical Sciences, Dean Boston, will come to the platform, this virtual platform, to make a very special announcement. Dean Boston, the platform is yours.
Thank you, Dr. David. Before I make my announcement, there's one last question from DVC Cummings. He said, West and East African countries have comparatively low rates of COVID-19 as compared to other countries. Can you say if traditional foods may play a role in this?
I can agree to that because we have also tested that formula a lot, and it works, and it keeps working. You know, like ginger, turmeric, garlic, and all those spices. We keep using them, and we don't even allow them to go out of stock in the house, and it keeps the immune system stronger. Those traditional foods is very important. Like, can I tell you something about this region? This region, we make traditional, we make a lot of traditional delicacies, which is quite rich in vegetables. We have very rich indigenous vegetables here in Africa, in this part of Africa. And those vegetables, sometimes we dry them, and we also send them out to our loved ones in the US, some in the UK, some in Australia, and some even, in the temperate world, wherever they are in Asia. And let me tell you something about Southeast Asian country, Malaysia. I was in Malaysia in 2013, and I saw that Malaysia was able to borrow our oil palm seedlings, and some persons think it's only oil palm. They also borrowed our vegetables, some of our traditional foods. They are eating it in Southeast Asia. And that can now tell you that we are very rich in these traditional foods that can help to fight COVID. Fight it and knock it out. We have them. We have them even for diabetic patients. Well, my brother bought a drug recently for to manage his diabetes, and when he looked, all the way from the US, it was bought, here in, when it was brought to him in Nigeria, and he looked at the primary material used in producing it. It's bitter leaf, and bitter leaf grows everywhere here. Bitter leaf is very powerful vegetable. You can Google it if you don't know it. Venona amygdalina is the botanical name of bitter leaf. It's a vegetable that is quite rich in, antioxidants. It has therapeutic properties as well. So let me stop here.